Hi, I'm Drew Flex, and welcome back to my channel. Join me as I'm fighting cancer with fitness. Don't forget to subscribe, like and share, and press the bell button for the latest updates and notifications from me, Drew Flex. Today, I've got my routine cancer appointment, my 3-month checkup. So, without further ado, let's do this. Well, I'm outside St. Bartholomew's Hospital and I'm going to have my free monthly checkup now for my CML. So let's go inside and see what the results are going to be. It's going to be a bit of a long day. I've got to do my bloods first, then I've got to go and see my oncologist, and then I've got to collect my medication afterwards. So let's see how the day progresses. So I'm here about to get my bloods done. I've just seen one of my friends who's actually going to have a stem cell procedure done today. So shout out goes to him, and I hope it all goes well. Normally it's a bit of a nervous time for me when I'm getting my bloods done. Don't really like needles, even though I've got loads of tattoos, but it's necessary for the treatment. So once the blood's done, I'll go get some lunch, then I'll see my oncologist, and then we'll see what my progress is, and then we'll collect our meds, and then we'll be on our way home. Okay, so I've just finished doing my bloods and I've had a bit of lunch. Had a good appointment. Interesting development. I've been asked to take part in a clinical trial, and when I get in from this appointment, I'll give you a bit more details about that. I'm a bit early to see my oncologist. It's just gone 1:05 and the clinic opens back at 2 o'clock. So once I've seen my oncologist and I've been able to discuss what's going on, the details of the clinical trial, then I will have more to tell you. So I've just finished my appointment. It wasn't with my normal oncologist, but the person that I did see was actually really quite good. So we discussed, among other things, my medication. Now, as a lot of you would have been aware of from my social media, I've been having quite a lot of bone and muscle pain, which I had to go for MRI scans, ultrasounds and x-ray, which revealed that although there is a slight disc bulge, there isn't actually enough damage there to warrant any procedures being done. So it was kind of referred back to having a medication review of sorts. So upon that, I've looked into some alternative meds with the consultant that I've just seen, and we've identified 2 possibles, dasatinib and nilotinib. The complexity of taking nilotinib, sorry, I'm tongue-tied myself, nilotinib would mean that I would have to make sure that I'm fasting 2 hours before and an hour after taking meds, and that would be twice a day separated at 12-hour intervals, which with my eating and training regime probably wouldn't work for me. Dasatinib is also good at controlling some of these side effects as well as treating the CML, but 1 in 10, they say, people will probably experience fluid retention around the lungs and possibly around the heart, so that could lead to complications with breathing, and if any of those are noticed, it needs to be stopped straight away. I'm going to have a 2-week treatment break, so I won't be taking any medication for the next 2 weeks and let it wash out of my system, and then afterwards we'll have a look and see if the side effects with the bone and muscle pain are the same. If they are, then we'll probably still try another medication to see if things improve, and definitely if they're not, we'll definitely be switching over to another medication. I'd like to give another medication a try because I have persevered for as long as I can with imatinib. So let's just see what happens. I finished early, I have no medication to collect, so I am going to go to the transport lounge and take myself home. So I've got home now from my appointment, and I've got to say today was actually a really good day. I managed to speak to the consultant. I'm gonna have my 2-week treatment break. We're gonna see if the medication itself is at the root cause of a lot of the distress that I'm experiencing within my hip and in my pelvic region, with regards to that debilitating bone and muscle pain, and I'm going to give the medication a chance to flush itself out. Then we can further investigate that and then start on a new treatment regime and see if those side effects are going to be less, and see if the medication will be as effective as the imatinib. But the dasatinib and the nalatinib, they're within the same kind of league. So those three are the three that are recommended, as far as my oncologist was concerned. The other big piece of news is that when I went to do my bloods, I was offered the opportunity to take part in some clinical trials. Now, when I first heard clinical trials, I thought, oh, is it going to be a new medication that they're going to trial me on? Or, is this going to be some kind of new treatment? I'd heard of the CAR T therapy, which I'm going to do another video on, so we can explore more about what this CAR T therapy actually is with regards to leukemia. But no, it's actually a simple thing as collecting blood from myself. I think they in total collected 4 extra vials of blood from me, and the purpose of it is to check for mutations within the cancer cells. So I've got some information here which I am going to have to read from the paper for you, but the cancer cells, there may be a tendency for them to mutate, and it's really about where they go with their mutation and if my treatment regime would need to be adjusted to suit. And that's the purpose of collecting the blood from me and for these clinical trials, is to see how it can inform where treatment would go. So it's important to identify when a patient's cancer has developed a mutation, as this can help the doctor decide which other treatments to try. Mutations in the cancer cell's DNA have routinely been detected using a technique known as Sanger sequencing, or SS. However, in some cases the mutations may only be present in a few, not all, of the cancer cells. These are known as low-level mutations and can often be missed by Sanger sequencing. However, a new technique called next-generation sequencing, or NGS, has become available. This has a higher level of sensitivity and can detect mutations when they are present in only 3% of cells. With Sanger sequencing, the mutation would have had to be present in over 20% of cells for it to be detected. NGS can therefore detect clinically relevant mutations that are not found by SS. Another method used to screen cancer cells for mutations is called Droplet Pcr, but this test is just at the early phase of its development. So the purpose of this study is to use NGS to calculate the frequency of mutations in the cancer cells of patients with CML or PH plus ALL who are being treated with a first or subsequent TKI. And if you look at my video before on what the tyrokinase inhibitors are, you would know that they are used in the treatment, groundbreaking treatment for chronic myeloid leukemia and for other forms of leukemia and blood cancer. So that's it, really. The trial's gonna enroll 400 patients in about 40 sites in the UK, of which I'm one. It was just taking a sample of my blood, and they are basically going to study that to see where treatment will go afterwards. As I get updates on this clinical trial, I will bring you those, and we will see where the treatment goes from there. That's it. That's all from today's edition. I hope you enjoyed the content and you got a bit more insight into what my journey with leukemia is like. Don't forget to subscribe, like and share, and press the bell button for the latest updates and notifications from me, Drew Flex. I am Drew Flex, and until next time, stay flexing.